In a devout Catholic country like Mexico, it's almost unthinkable that churches should be forced to close their gates to worshippers. Football matches have also been cancelled as the Mexican authorities belatedly try to control the virus. But you can't shut down a capital city.
The metro system is still running, and the metro system in Mexico City bisects the entire city. And so if this virus is as bad as what we're being told, one way that it would travel would obviously go by people going in Mexico City via the metro.
In Santiago, Chile, thermographic cameras were used to scan passengers arriving on flights from Mexico to check if they had a fever. Symptoms include a temperature of more than 100 degrees, body aches and coughing. Similar equipment was deployed by Japanese officials at Narita Airport. But despite such international efforts, global travel means some foreigners have apparently come into contact with the virus. Several French tourists are showing symptoms, while 10 New Zealand students recently back from Mexico have been quarantined.
The Ministry of Health officials advised me that there is no guarantee that these young people have the swine flu, but officials believe it is highly likely that they do.
In New York City, 8 high school students became ill with an unknown strain of flu.
We tested samples in our public health lab yesterday and determined that they were probably swine flu. We flew the samples to the Center for Disease Control in Atlanta yesterday, where they have a newer test that's a little more sophisticated. And today we can tell you that, as we anticipated, the CDC has confirmed the diagnosis of swine flu in children whose samples we sent them.
Passengers returning to Gatwick from Mexico had to fill out a questionnaire when they arrived.
We had to wait for, 15 minutes, and then they asked us if any people had any symptoms. And the same in Mexico. We had to fill out forms about symptoms if we had, headache, any lung problems, fever. It was like a list of 12 things.
In Mexico, the death toll has reached 81, with 1,300 others infected. And worryingly, it's not just vulnerable infants and the elderly who have become ill. But supplies of antiviral drugs like Tamiflu should prove effective in treatment.
One can use it prophylactically to prevent the infection. Usually people are thinking about using the drug in the treatment mode just to lessen the severity of the infection.
As Mexicans displaying symptoms head for their local hospitals for a checkup, other patients are checking out for fear of contracting the flu. Many have calculated that the safest place to be is at home and are stocking up on supplies while they isolate themselves from their neighbours. Ian Woods, Sky News.